About to have the main discussion, and I have here with me a very esteemed lady. She is a doctor, and she's in the person of Dr. Victoria Partey Newman. She's a resident physician at the public health. She's a resident public health physician at the West African College of Physicians and Surgeons. She's also a women's health advocate for the past 10 years and still ongoing. And of course, she is the CEO of Lady Bits Health and Wellness Foundation, which offers free mobile screening services specifically for women with regards to their breasts and cervical screenings in the rural areas. She's also a general physician now at the Trust Hospital. So now let us get acquainted with her and start our discussion. And today's discussion is about the prevalence of the hypertension and diabetes in the youth, and we are here to just talk about it, educate the youth on everything related to hypertension and diabetes, especially in the youth. So, Dr. Victoria, thank you so much for joining us here, and it is such an amazing opportunity to have this opportunity to talk to you. And so now we have to just get straight into it. Diabetes and hypertension have become very prevalent among the youth here in Ghana. And according to some studies I also read, the range is between 19.3% and then 48.8%. So Cocoa Digest here, we want to talk about it, teach everybody about hypertension and diabetes and how to just take care of ourselves better. So let's get straight into hypertension first. So can you tell us what hypertension is?
Okay. So hypertension is just, in normal layman terms, high blood pressure. So that's when there's a pressure buildup in the arterial. Arterial is artery, the arterial walls of the blood vessel over time, leading to end organ damage.
Okay.
Yeah.
So is there a way to know that you are hypertensive?
Yeah.
You know, are there some symptoms that come off?
Okay. So usually hypertension is a silent killer.
Okay.
So you would notice sometimes someone will say, oh, she was walking and then she collapsed. Usually it doesn't come with symptoms, but if it does come with symptoms, you are lucky enough so that you're able to go to the hospital, is diagnosed, and then you are put on medications or your lifestyle modified. Okay. So some of the symptoms can be dizziness.
Okay.
Dizziness, just abrupt dizziness. And then sometimes you could also have weakness.
Okay.
You do a little thing, you are tired, anything, you are sluggish. And then probably you could also have palpitations.
Okay.
That's when your heart beats faster than usual.
Okay.
Sometimes some people actually sleep and wake up at dawn because of the palpitations.
Okay.
Sometimes there could also be shortness of breath. You know, there are so many symptoms, so you wouldn't really know if it's hypertension.
Okay.
So that's why we recommend that you keep going to the doctor, in case you have different symptoms that come up with, like, knowing that it's hypertension.
Okay. So how do you know you're hypertensive? I mean, we go and do the checks and then they write some numbers down. What are the variations or variables that show that, okay, this person has high blood pressure?
Okay, so we use a BP machine in layman terms.
Yes.
It's actually a sphygmomanometer.
Okay.
Okay, so let's say sphig.
Okay.
So that's the sphig. That's when we use the cuff around your arm, especially for the left arm. It could be any of them, but mostly the left, because the heart is here, the brachial artery. So we use the left cuff, and then they check electrically, digitally, and then you're able to pick up. So there are some classifications according to the American Heart Society.
So before we get to the numbers, let's cue the video and then we can watch how it's done. So this is the BP machine, the sphig, yes. Okay. So
before testing, empty bladder and sit quietly for 5 minutes before testing. Do not take medication until after taking the blood pressure reading. How to use your blood pressure unit correctly. Ensure the cuff is correctly positioned on the bare arm just above the elbow crease. Sit upright with back supported. Uncross legs with feet flat on the ground. Support arm at heart level on flat surface with palm facing up. Sit quietly while measuring. Record your blood pressure reading in the Heart Healthy Lifestyle Diary. After 5 minutes of rest, measure the blood pressure 2 more times with 1-minute intervals between. Then, record the 2 values in the Healthy Lifestyle Diary. Share blood pressure readings with doctor at each clinic visit. Measure your blood pressure at least 3 mornings.
So that was a short video on how to check your blood pressure. So let's get back into the numbers that they write for us. So how do you know, okay, I'm hypertensive now?
So according to the American Cardiac Society, we have the normal blood pressure.
Okay.
We call something systolic. That's when the heart is beating.
Okay.
And diastolic is rest between the heartbeats.
Okay.
So for a normal blood pressure, you're supposed to have a systolic less than 120 and a diastolic less than 80.
Okay.
That's
so
for the normal.
The systolic is which one? The up, the one
up
at the top.
figure
Okay.
is the systolic.
Okay.
And then the down figure is the diastolic.
Okay.
Yeah. And it's supposed to be less than 120 for systolic and less than 80 for diastolic. That's for the normal. Then we have the elevated blood pressure.
Okay.
That one, the systolic is between 120 to 129.
Okay.
And the diastolic is still less than 80.
Okay.
And we now go to the hypertension stage 1. That's where the systolic is between 130 to 139.
Okay.
And the diastolic is between 80 to 89. Okay. And that's we go to hypertension stage 2. And that's where the systolic is above 140 and the diastolic is above 80.
Okay.
Finally, we have the hypertensive crisis or emergency. That's when the systolic is above between 160 to 180, and then the diastolic is above 100 to 120.
Okay.
Yeah, so those are the stages. So usually when you come to the hospital, your BP is checked, but checking your BP on an instant does not diagnose you as hypertensive.
Okay.
We have something we call the white coat hypertension, where people actually just are scared of the hospital.
Yes. Okay.
And the settings are just not conducive for them. Surprisingly, when they go home, their BPs are fine.
Okay.
So with that, you can't just say, okay, start medication. So usually we do something we call like a BP profile. We write a BP profile where we write your name, your age, and then your BP check morning and evening, and then we let you take it home. So we advise you buy as fake, and then you check when you are relaxed in the morning, and then the last thing you do before you sleep. We get an average of about maybe 5 days check morning, evening, and then we strike an average, and then we're able to pick up according to the criteria whether you are hypertensive or not.
Okay, so you mentioned that you recommend that we get the Spheg at home. So can you give us maybe the price range for our viewers to have a budget when they are?
Yeah, it's roughly around 300 to 1,000 Ghana cedis.
Okay.
Yeah.
So my dear viewers, if you are hypertensive and you need to be checking at home by yourself, please endeavor to buy a Spheg for yourself. It ranges from 300 Ghana cedis to 1,000 Ghana cedis. So just draw your budget around that line. Maybe you get a discount too. Maybe Dr. Victoria will give you a discount. So yes, about hypertension once again. What are some of the things that cause hypertension?
Okay, so risk factors for hypertension, we are looking at age. You know, as you grow older, your body is aging, wear and tear. Blood vessels aren't like before. There is also layering of cholesterol, narrowing the gap of the blood vessel, then causing increased blood pressure. It's just like a pipe. When the pipe gets, the water hose gets a bit narrow, the pressure is increased and it's bigger. So that's what happens. So age by gender, mostly males are more hypertensive than females. There's percentage of more males to females with hypertension, and then also race. African Americans, Ghanaians, Africans, we are at risk of hypertension compared to the Caucasians. And then also lifestyle. You know, now there's more of westernization, sedentary lifestyle. We drive to work, we use the lift, we sit, we order our food, it's brought, we drive back to work, we go home, and then we sleep. So that goes on for as long as we can continue. We exercise maybe once in a week, if you would anyway. So at the end of the day, you realize that that sedentary lifestyle puts you at risk of hypertension. And then our food, now we do the fast foods a lot. So you notice people in the rural areas do thrive better than the urban because they eat organic, they eat straight from the garden, they eat raw. But we eat mostly processed foods, you understand, and fast foods like fried rice and chicken and all that, you understand. A lot of cholesterol foods can put you at risk. So lifestyle, age, gender, race, and then alcohol. You know, you're permitted to take in a certain unit of alcohol a week. Usually for women, it's 10 units a week, men 14 units. Beyond that, you are damaging your body, toxicity to the body. So that could put you at a risk of smoking, could also put you at a risk of hypertension. And family history, like, so that's the genetics.
The genetics.
Once there's a family history of hypertension, your mom, dad, brother, elder brother, or anyone close to you, you're at risk of getting hypertension. So these are the risk factors.
Okay, thank you so much. It's getting very, very informative and educative here, but we would have to take a short break. Right after that, we'll be learning more about hypertension and then on to diabetes. So don't go anywhere. Call a friend and stay tuned.
Clog TV. Beyond the policy.
I just want to take a moment and thank everyone in law enforcement who helped us in the search for our beloved daughter.
There's no point hiding things from me.
You're psychic?
No, just paying attention. I've been watching you and your husband. I understand what you're feeling right now.
You have no idea.
I do. I know. Did you kill your daughter? How dare you?
Did you kill your daughter?
Jude, please. Honestly, it's not as bad as it looks.
Classic Red John smiley face. Drawn in the victim's blood. Gloves with 3 fingers of his right hand.
This isn't Red John. In all the previous killings, he made sure that the first thing that anyone sees is the face on the wall. Then, and only then, do you see the body of the victim.
What's that? What are you doing? Painkillers. Oh, for your leg. No.
Good.
Nothing. Just fun watching him blink. And no, I do not have a pain management problem. I have a pain problem. But who knows? Maybe I'm wrong. Good.
And then coming to work, not eating, rushing through, impressing your boss, making sure everything is okay, and then you close. Even when you are unemployed, relationships, our youth, we have our own issues going on. That also puts you at risk of hypertension. And some people stress, and that can also age them. So they age before their age, before they grow. So that can put you at risk of failure. I mean, it's general.
Yes,
everybody
is going through it.
Going through the stress.
So I heard that salt
Na plus coma, though she got better, but the whole point I'm putting across that she just prepared an innocent Kobe, your blood pressure. So high salt intake, low potassium diet. You need to eat fruits rich in banana, plantain, apples, and then also high cholesterol meals. Like mostly you could bake your stuffs. You don't need to fry all the time. And be careful of the oil you use. Soya bean oil, sunflower oil, sometimes olive oil. But olive oil under high heat is also
reusing oils or something could cause issues for your health. Is that also related to
so you see the oil, we have something we call saturated fat and unsaturated fat. The reusing of it, to reuse the oil, you kind of like create the bond. They have the hydrocarbon bonds, which are broken direction.
And even when we think about the foods we buy at work, we don't even know if it's fresh oil used every day.
Obviously, it's only fresh oil.
Okay, so aside the oil thing, what about the carbohydrate intake? Because our staple foods here is all maize.
Yes.
Does that also have anything to do with hypertension?
Of course, too much of carbohydrate increases your glucose levels, and then we come to diabetes.
Okay, so
and
that's
then with time, then we get to hypertension.
Okay, so we will get into diabetes very shortly, but so we've talked about how we can diagnose it, but are there different blood thresholds that we should be aware of when it comes to hypertension?
The classification?
Yes.
Yeah,
maybe, let's say, are there maybe blood groups or people from those, the different blood groups that are predisposed?
Everybody is prone to hypertension. It's not related to blood groups.
So what are some of the, long-term effects if it's not controlled?
Yeah. So long-term effects of hypertension, number one, you could get a stroke.
Okay.
There are two types of stroke. We have the hemorrhagic stroke.
Okay. So
and then we have
what is
the hemorrhagic. Yeah. Hemorrhagic is hem is blood. So blood. So bursting of the blood vessel. Yes, can cause hemorrhagic stroke. Unfortunately, that type of stroke is quite very serious. Intervention in our settings in Ghana is not so, unless very top places, which is very expensive.
Yeah.
Because most of the time you would end up dying with a hemorrhagic stroke. The infarctive stroke is when there's an embolus or blood clot in the blood vessel of the brain, so the blood can flow continuously, leading to an infarction. Infarction means lack of blood flowing in that area, leading to pain, and then at the end of the day, the patient can have hemiparesis. That's facial deviation, and then the gait, how the patient walks, is also changed and unable to. Some can speak, some can even swallow, and if you're not lucky, you can't breathe, and then that's when we have to send you to the ICU, and then that's where you're tailoring towards your death. So hypertension has side effects, stroke, and then we could also think of vision loss. That's the hypertensive retinopathy, your eye, gradually. So you need, as a hypertensive, you need to be checking, going to the ophthalmologist, checking your eye at least yearly, once in a year. Very important. And then, unfortunately, now we are having a lot of young adults with chronic kidney disease.
Yes.
Mostly from uncontrolled hypertension, denying the fact that you are hypertensive, not taking your meds, and then at the end of the day, it overwhelms your kidneys, and then your kidneys starts failing, and then you need to be on dialysis, and then gradually with time you get depressed and a whole lot of complications. So kidney damage, vision loss, stroke, and it could eventually lead to diabetes as well. So usually diabetes and hypertension, they go hand in hand. You could get hypertension and then get diabetes. You could get diabetes and then get hypertension.
Then it's good we are talking about both today. So we learn about the brother and the sister.
Yes. Exactly.
So what are some of the first line treatment approaches that you would recommend for somebody managing hypertension? So
like I said earlier, hypertension, we don't go straight to give medications. We monitor the BP. We get a BP profile check, especially at home. We monitor and then we strike an average. We know, your BP is above 114/90. Then we start, as you said, pre-diabetic, we also have pre-hypertensive, where we have to have a lifestyle modification, change in diet, so to see a dietitian. Maybe weight, one of the risk factors, so you have to work on your weight. And then you also have to cut off your stresses. So as doctors, we usually find out what's going on at home, family problem, work pressure, children issues, is anything, and we try to, as much as possible, cut off the stresses. If it's beyond you, we refer to a psychologist. So it's a whole multidisciplinary approach in the management of diabetes, of hypertension, not just the doctor. So the doctor, the dietitian, the psychologist, and some of them are in denial in the sense that they wouldn't want to take their medication because they don't think they are hypertensive. And that can also put you at risk of having the complications. And I want to put this across: if you're a man and you are not taking your hypertensives, your antihypertensives, please do take your meds, because most men have the myth that when you you are hypertensive and you take your medications, it eventually affects your sexual performance. But the doctor gives you your medications. If you're having such issues, it's good. You kindly come back to the hospital, tell your doctor your complaints, and there will be medications adjusted to sort out that issue. Because it's not all antihypertensives that cause low sexual performance, which is very important.
Okay, thank you for that note. So please, my dear men, I hope you have listened to the doctor. They know what's good for us. So please, take your antihypertensive medications, and if you have any issues, just see your doctor once again. So about the, what's the word? Yes, preventive measures, or maybe, okay, hypertension is chronic, right?
Yeah, it's a chronic illness.
It's a chronic illness, so it doesn't go away. So how then would you recommend that we manage hypertension?
So you see, management of hypertension is a team play.
Okay.
Both you as an individual and the doctor, you should have a good team play work, in the sense that do your part as a patient, and let me also do my part as a doctor. Be prompt on your visits and your annual visits, your checkups, monthly checkups. Be prompt on your medications. You don't need to wait till your medications get finished. Hypertension is so serious that when you even lose, like you actually decide not to take your meds 2 to 3 days, you could just have a collapse. Anything could happen. I have a close friend of mine, the dad, I think that was like 4 years ago, where we go on outreaches for breast screening. We went on one, and she actually said, oh, I have to buy my dad's meds, but I'm busy, so probably I'll do it on Saturday. The dad meds finished on Tuesday. On Sunday, the dad died. Yeah, just within a short time. Yeah, so it's so important that you don't lose, like, just be ahead of the medication refills. And then as much as possible, be monitoring your BP. But I also have a problem with that. A lot of the time, the patients over-monitor their BPs.
I was going to ask.
They check it like 4 times, 3 times a day. And what do you expect? You call the doctor saying your BPs have gone up. Of course, because you are anxious, you are worried, you are checking. So definitely your BPs will go up. So I recommend, when you're newly diagnosed, at least have your BP checked once in a day. And then probably we taper it off to once a week. And then you go to once in 2 weeks, and then once in a month you check your BP whilst you're on your medications, you understand? So you should try your best not to overdo it. And don't be listening to people around. Okay, I had my hypertension and this happened. I had this hypertension, this happened. Just, everyone is an individual on its own. So just focus on you and your doctor, and then I think things will get better. And don't hide your diagnosis. Let your family know, so that there'll be support on the treatment. Your kids will remind you of your medications. You don't need to hide it and be taking it in your car. You ideally put your medications in your bathroom, so that once you brush your teeth, then you just take it. You don't need, normally the antihypertensives are not related to meals, so you could take it before meals. So it shouldn't be an excuse that you come to the consult, you tell a doctor that you forgot your meds because you have not eaten. And that's what most of them do. Yeah. So make sure it's taken right after brushing your teeth. You just take your BP meds every day.
Okay. So about even the playing our role and things, let me frame the question well. So when the patients tend to omit, let me not use a lie, they omit certain bits of information, like, oh, I took some alcohol over the weekend, or I forgot to take my meds for a few days. How badly does it impede the progress of work?
Yeah, that's a beautiful question, because one of the people you have to be playing with is your doctor. We swear an oath of secrecy, confidentiality. We have your information. Doesn't mean we're going to take it out. So you need to open up to your doctor, tell exactly what is going on. Doctor, I had alcohol, I took these medications, I overdosed. You know, it's just because it makes the doctor know where he or she is heading towards in your treatments, you understand? So it's very important that you are open and honest about your decisions over the weekend, over the week, what happened to you. When you are rushed to the hospital, tell the truth. I took this, I did this, and I did that. Then it doesn't waste time, because the doctor, because we run a series of tests to avoid costs. Just once we know what is wrong, we go straight to it. But then we'll have to run a general test, and then I don't want to call it like eventually you die, because you just was withholding some information. That's very important.
Okay. So yes, one more question about managing the stress. I mean, when we were prepping, we were talking about finding some leisurely activity. So can you throw more light on that for, we the youth that we are so busy looking for money to start life, the hobbies and things that we can engage in that can reduce our stress levels for us?
Okay, so on campus, you just go for hiking. Make sure you go in groups.
Okay.
Hiking. Be engaged more with the naturals.
Okay.
You can do gardening at your backyard. Yes. If you like plants, gardening is good. Swimming, tennis, yes. Playing tennis is also cool.
Yeah.
And find a hobby. You could be going for dancing classes.
Okay.
Something you enjoy, something that you do without stress.
Okay. And I mean, some of the things you've mentioned, they seem to even serve two purposes. Something like tennis, something like the dancing, it would serve as a form of exercise as well as also having some fun. Okay. So that was, yes.
And let me put this across. When you are newly diagnosed with hypertension and you're a worker, a young worker at your job, don't be scared to let your boss know, because usually we doctors write an excuse duty for you to rest and then pull yourself together, start your medications, and then start work at an appropriate time that is good for you. So you don't have to be cover up when you are diagnosed with hypertension, because it could be that it's from your work, so you need to take some time off. So just respect the doctor's decision. And this goes to employers as well, that when a patient comes, when your staff comes with issues of hypertension, diabetes, and they have been given excuse duties, just respect the doctor's decisions and give them time off, because we would want a very capable and efficient worker all the time. Yeah, which is very important.
So with this stress issue again, sometimes when I travel maybe to the Volta region, when I get to Atimpuku, knowing that I'm coming back to Accra, is just everything is back. How do we manage something like that? Yeah. Because you've had all the fun, the memories. When you get back, you're entering Accra.
You know that, feel the heat.
Yes, so
okay,
how do we manage something like that?
Yeah, but you know what? Don't forget that you've de-stressed.
Yes.
So your body is ready to take up the stress again. It's just like a wall. You keep hitting the wall and you don't see any change. You keep hitting the wall, you don't see any change. Eventually one hit, which could be very small, then the wall breaks. So doing the same thing over, causing the issues with hypertension and taking a recession, taking time away from the usual thing you do is worth it.
Okay.
And that's where the psychologist comes in play, because they would have to teach you how to manage your stress.
Okay.
We want to do everything. We want to achieve everything. We are over-ambitious.
Yes.
We want to, I'm doing this. And women, we multitask a lot.
Yes.
Puts us at more stress. So all these things, you'll be counseled on it with a psychologist, so you know how to handle your stress.
Okay.
If you need to take some time off, maybe some minutes to pull yourself together, you'll be taught that. So you won't come back overwhelmed.
Okay.
Especially when you've opened up enough to your psychologist and they are able to do a good work on you.
Yeah.
You would know how to manage. It's actually a topic, how to manage stress.
Okay.
How to manage, because the truth of the matter is that there's stress.
Okay.
And we have to face it. It's there.
Yeah.
I understand.
So we have a question from Abna Mimi, and she says, please, can overthinking cause hypertension?
Exactly, yes. It can cause hypertension.
Yes.
Overthinking can cause hypertension because you are overexerting your brain, and you are thinking, and it stretches the blood vessels, and then it can cause hypertension. It increases your cholesterol, your cortisol levels, leading to stress, and then can cause hypertension. So usually when you realize, and be smart about your body, because when you notice you're overthinking, just engage something, make a call a friend, intentionally visit. A friend will be like, why are you here? Oh, I just came. Just try hard for yourself. Okay, just try. Don't just watch yourself overthink and then wallow in it and think that you'll be okay. Try hard. If it's church you would go to feel better, you go to church, you pray and feel better. Just make sure you are just thriving.
Yes.
Just thrive.
Yes. So you heard from Dr. Victoria Partey Newman. She says, just thrive, just do anything you can to thrive. So yes, what advice would you give to our viewers about hypertension, how to just manage basically everything in a few words, your closing remarks on hypertension before we move to
so
diabetes.
hypertension now, the parameters, we are moving to the youth now, which is why we are having this topic today. So most importantly, it's a team play between patient and a doctor. So I need more of the youth to learn to come to the hospital when they engage with symptoms of dizziness, weakness. They should just come to the hospital. They should take their meds as they are supposed to. And then lifestyle modification goes a long way. You know, now we want the shortcut for everything. Even our meals, we want fast food. Everything fast. So we should go back to our dada, titino, the old things our women, our mothers were doing. Yeah, so we should go back and then we eat the organics. You know, and surprisingly, the organics are very expensive.
Yes.
But why would we spend so much on Brazilian hair and a lot of money on other stuff? So why don't you invest in your food, what you eat, where you buy your food, the kind of vegetables you buy? Some of them use fertilizers, which are not good. You should be probed to find out where you are getting the source of your vegetables from. So just be careful where you buy your stuffs. Yeah, and I think on a whole, just take advantage of free screenings when they want to check your BPs, and then make it quick to the hospital when your BPs are high.
Yeah, okay, thank you so much. So we have a few questions. So this one says, hi, I'm Ruth. My close friend died a week ago from blood pressure, but from sources it was said that she has been hypertension free. So how come she died through that? What might really be the cause?
Oh, I think she would have been hypertensive underdiagnosed.
Okay.
There is something we call maxed hypertension, where you come to the hospital and surprisingly, luckily for you, your BPs look normal, and the doctor thinks you are fine. That's why home monitoring of BP, everyone is as figure home, randomly check at any time. Because it could be that her BPs were up, but at that time at the clinic it was normal, and then she thinks she's fine. And I earlier on said that hypertension is a silent killer. Yeah, so you wouldn't know the symptoms are coming up, and then...
Okay, so I hope your question was answered, Miss Ruth. So this is also from David. He says, so David Akumbobia from Tamale, he said, please, is it good to include anticoagulants to their medication or put them on it from time to time, since most of the defaulters eventually experience some dysrhythmias causing clots, which eventually lead to stroke?
I think, what's his name again?
David Akumbobia.
David, I'm thinking you are more health inclined, because from what you are saying, it seems to know what you're talking about. Yes, anticoagulants are important in the management of hypertension, but should be prescribed by your doctor, not taken on your own. The anticoagulant melts the blood to prevent clots, for flowing of the blood, which is very good. So it's very important you take it, but should be prescribed by a doctor and monitored by a doctor.
Okay. So, yes, even about the anticoagulants, how do they work? I know, it's for blood thinning, but if, let's say, the arteries, you mentioned that the arteries can be clogged with cholesterol. Do they also melt the cholesterol? Or?
No, they don't. The anticoagulants, there are some enzymes that help with clotting of the blood. So immediately you have a cut, the blood flows, then it clots. So usually people who don't have those enzymes, they call intrinsic factor, hemophilia. They have this blood, is called hemophilia. They can bleed to death. Yeah. So usually the anticoagulants kind of stop those enzymes from working, so that there will be no clotting, and then there will be
just flow more.
But when you're about to have surgery, it should be checked to make sure that you are not on anticoagulant, because then you could bleed. So all those things, that's why I said it should be prescribed by a doctor and monitored by a doctor.
So please send your comments and suggestions. Please refrain from the calls for now. We are taking only messages and comments on our streams. So we have 3 more questions here, but one question says, I should ask if too much intake of salt can cause hypertension. Yes, she said that earlier in the discussion. She said the high sodium intake can cause that. Then someone is also asking, Doc, please, can lack of sleep cause hypertension? If yes, please, if you can elaborate a little.
Of course, lack of sleep makes you stressed.
Yes.
You don't have enough sleep, and we are entitled to 6 to 8 hours of sleep a day.
Yes.
So if you don't give your body that enough sleep, you can't cheat nature. So the body starts producing cortisol, and the brain has some receptors that start getting activated to increase your BP, and then it goes up. So lack of sleep, not only high BP, it can even give you mental illness. Yeah.
Okay, so one comment here says, I'm enjoying the show very much. Thank you so much. I'm watching with my sister and she's learning a lot. She was diagnosed last month and she refused to take her medication. I'm John watching from Tema. Thank you, John. Thank you for grabbing your sister to tune in and learn something today. I'm sure from today she'll change her attitude, because our doctor here has given us lots of information that we can learn from. So yes, we are encouraging you to send in your comments and your questions. We will read them aloud so that you can get answers to them. But right before we discuss diabetes, we're going to take a short break, and then when we come back, we're delving into diabetes issues. We'll be right back.
Clog TV, Beyond the Policy.
Tigress! I'm the big fat panda.
The whooshy finger hold.
Oh, you know this hold.
Did not see that coming.
Choose someone else.
This time I will make damn sure that he stays dead.
I don't know how to stop him.
You start by letting people help you.
But he's gonna come after you.
Let him come. I'm not that easy to kill.
There's a new player we've been tracking. We've been calling him Deathstroke. Find him.
This started with the two of us. That's how it ends.
You can't go out there by yourself. It's suicide.
They're designated Task Force X.
Welcome to the Suicide Squad.
OJ and Charles Manson one available?
Deadshot is a go.
Shrapnel's a go.
Tiger's a go.
I created the Huntress.
Yeah, well, you created Slade too.
I have my allies, just as you have yours.
Be prepared for anything.
If they're wearing a mask, they get a bullet.
Once you let the darkness inside, it never comes out.
What are you gonna do? Kill me?
Clog TV, Beyond the Policy.
What's that? What are you doing?
Painkillers.
Oh, for your leg.
No, because they're yummy. Problem. But who knows? Maybe I'm wrong. Maybe I'm too stoned to tell.
Clog TV. Beyond the policy.
You are welcome back to the Cocoa Digest Morning Show. If you are just tuning in, we are talking about hypertension, and soon we'll be discussing diabetes as well. So we have a few more questions just before we get into diabetes. But before that, let me actually give a shout out. So thank you, Charles, the CEO of Rose. I think a few people tuned in a bit late. So someone was asking, what is the range for the diastolic?
Okay, levels of hypertension.
Okay.
The normal hypertension, I think I earlier on explained systolic and diastolic.
Yes.
Systolic is the heart beating in the artery, and diastolic is the rest in between the beats. So with a systolic, it should be less than 120, and a diastolic less than 80 for normal pressure. Okay. Then we have elevated blood pressure. Yes. That's between 120 to 129 for systolic. Yes. And between less than 80. Okay. Okay. So 120 to 120, less than 80, that's the elevated. Then we have the hypertension stage 1. Yeah. That's between 130 to 139 and 80 to 89. Okay. That's for stage 1. With stage 2 is above 140 and above 90. Okay. That's for stage 2. Okay. Then we have the hypertensive crisis. That's above 160 to 180. And that's for the systolic and the diastolic. This is from Mark. Good. That's a good question. You earlier on talked about the complications of hypertension. Yes. So one of the complications is coronary artery disease. That's where the blood vessel starts having problem. So the coronary artery has to do with the heart. Yes. So the heart blood vessels start layering with cholesterol. Eventually, blood doesn't flow well. Okay. So when blood doesn't flow well to a particular place, there's something we call ischemia, okay, or should I say lack of blood in that area. Yeah. And that can cause pain. Okay. So that's where we have the myocardial infarction. Okay. That's the heart. Myocardial is heart. Then infarction is lack of blood flow. Okay. So myocardial infarction. And that's the heart attack. Okay. So when you feel pain in your left chest attack or an extensive one, depending on the severity of the pain. Okay, okay. So another question about hypertension. So I think I even asked about it. It says, please, is it true that those with blood group O have high BP? For that question, I leave it for you people, because like in medical wise, we don't go according to blood groups, having hypertension. Studies haven't shown that. But I read theories around that. Okay. People say when you have blood group O, you are prone to having peptic ulcer, you are prone to being hypertensive. Yeah. When you have blood group B, you are prone to having hematological disorders. But those theories are for some side of medicine, not the orthodox medicine. Okay. So I think that's all for the questions for now. But you can keep your questions coming in. We would refer them to Dr. So yes. What is diabetes all about? Okay, so diabetes is, ideally, there's not supposed to be glucose in the blood, or there's a threshold that should be permitted in the blood. Okay. Above that threshold over a period of time makes you diabetic. Okay. So increased blood glucose levels is diabetes. Okay. So, and it's a chronic illness. Okay. It's also a metabolic disorder. Okay. Metabolic has to do with the body assimilating, absorbing, digesting a lot of the things that go on in the body. So Diabetes is a metabolic disorder which is chronic, which has to, checks are very important because when you are picked pre-diabetic, you start being, it's a wake-up call. So pre-diabetic, there are parameters that make you diabetic. So a little below those parameters could put you at pre-diabetic.
Okay.
We have the fasting blood sugar we do. That's when you fast over 8 to 12 hours. Okay, let's do over 8 hours before it's checked.
Yeah.
When it's above 6.1 millimole, it means you are diabetic.
Okay.
So pre-diabetic should ranging from 5.6 millimole to 6 means you are pre-diabetic.
Okay.
And then we have something we call the glycated hemoglobin check, which is to check the control of blood glucose over 2 to 3 months, which is really a standard test to know if you are diabetic or not.
Okay.
Usually above 6 puts you in the range of being diabetic. Yes, so when you are getting ranges of 5.9, 5.7, 5.6, 6.1 of glycated, you should be watching out. Then we start thinking of lifestyle modification, change of diet.
Yeah.
We let you see the dietitian.
Okay.
Then we have the random blood glucose test. That's, you come to the hospital, we think you are diabetic, you've eaten, we can just do a random test. Your value shouldn't be more than 11.1 millimole per liter. So above that, there's a question mark. And then we have something we call the oral glucose tolerance test, which is like ingesting glucose, raw glucose, to see how your body processes it.
Okay.
Then it could be that you are pre-diabetic.
Okay. Okay. So yes. So we've learned about pre-diabetic. Now, what does type 1 diabetes do?
Okay. So diabetes has 2 types. We have type 1,
and
type 2, and we also have gestational diabetes.
Okay.
But that's not our focus. That's with pregnancy.
Okay.
So type 1 is more of autoimmune, more genetic related. It has to do with family history, where the body's own immune system fights the beta pancreatic cells in the pancreas, destroying the beta cells, which are the insulin producing cells. Remember that insulin is a hormone that regulates the blood glucose. So when it's destroyed, it means that there's no hormone to regulate it, and then the blood glucose are all over the place. So usually with type 1 is picked early, like 11, 9 years, 8 years, 10 years, 12, you are already having high sugars. And it does very well with insulin, because that's what they lack. Yes.
Okay.
Then we have the type 2. That's the sedentary lifestyle type. That's more of lifestyle change. That's more of weight, obesity, alcohol. All those are reasons why you can have type 2. That can go if lifestyle corrected.
Okay.
And that can also get worse if not corrected. With type 2, you do very well with oral medications. And then you adjust your lifestyle and then your diet with type 2. Yeah.
So what does it mean if you have type 2? Because type 1 is just autoimmune, it's your body that's doing it. But what does it mean if it's type 2? Like, is this something you did? What's the indicator that, okay, yeah, you have diabetes now?
Yes.
So maybe symptoms, yes, I would say.
Okay, so what are the symptoms with? So with type 2, increased thirst. You drink water a lot. You realize usually you don't really, you don't drink water like that much, but now you're drinking a lot. Increased frequency of micturition, or let me say urination. You urinate frequently, usually more than usual. And then excessive sweating. And then you become catectic, you lose weight. And then you generally look unwell. And also you have brittle nails, your hair, there'll be hair loss, brittle hair, and irregular menses for women. All those are signs of diabetes, as well as you are at risk of infection. Because what happens is that diabetes makes you immunocompromised, meaning that your immune system is quite on the low. So you are prone to infections. So when you have a lady come in repeatedly for urinary tract infections, in the hospital, we screen for diabetes, because why do you keep having the infections? So diabetes puts you at risk of infection. So these are the signs and symptoms you pick up when you're diabetic.
Okay. So like hypertension, where you can have the SPEG machine, is there a way for diabetic patients to also be checking and managing their diabetes?
Yeah. So usually we use the glucometer.
Okay.
So that's the machine that we have a needle, we prick the thumb and then make sure the hand is clean, and then we check, and then I spoke earlier on the parameters.
Okay, so
for
the same thing is done with diabetes too?
Yes,
okay.
You check, and then you have to draw a profile.
Okay.
So we give them a profile to check how their sugars are, and then we kind of find an average to find out exactly how the sugars are. But with diabetes, it really involves the patient.
Okay.
It's one of the diseases that a patient owns. You own diabetes. You own your disease and manage it, in the sense that the doctor doesn't do much, because you know what you eat.
Yes.
Some lie.
Yes.
You know what you eat in secret. You know what you eat at night. You know what you feed yourself with. So it's all about being honest to yourself. Because usually when those things are reversed, your results are better.
Okay.
And the doctor isn't there with you to see what you are doing. So the youth, it's not fashionable to be saying you are going to Kempinski to eat this, to eat that, and all that. It's you can show it on your Snapchat and all that, but once in a while, not bad, but not something you frequently do, eating fast foods and all that. Usually when you are diabetic, you need to control your carbohydrates. You need to check. Usually there's a sugar profile, and then after every meal you check. So you notice that, okay, when I eat banku, my sugar spikes.
Yes.
When I eat kenkey, it spikes. Okay, so no more kenkey, then you rule that out. Okay, so potatoes, that's well for me, because my sugar doesn't spike well. Okay, when I take apple, but I realize when I take oranges, it spikes. So it helps with the monitoring. And so diabetes is owning the disease and taking care of yourself.
Okay.
Yeah.
So you mentioned that type 1 is autoimmune, but type 2 seems to be more of a lifestyle thing. So is it likely that maybe someone who's diagnosed of type 2 changes everything, you know, they do the dietary changes, everything. Is it likely that the diabetes would vanish completely?
Yeah, most likely it can. Okay. It can vanish, but when you go back to that lifestyle, it can come back.
Okay.
Sometimes it buys time.
Okay.
The lifestyle helps a lot.
Okay.
So usually you can be diagnosed 2015 that you are diabetic, then you go through a drastic change. You're not going to eat this. Then they check and it's down. So your medication dosage is down.
Okay.
Immediately you start going to all the things you used to do again, then it goes up. Okay. Then your medications have to go up. So lifestyle is very important.
So much like the way the type 1 is autoimmune and is more genetic predisposition, is that the same for the type 2 as well?
Type 2 there could be a family history,
yes,
which puts you at risk of being diabetic,
okay,
by your own lifestyle.
Okay.
So you see, so that's why you should be proactive to ask questions. Okay, this one died of this. Okay, my uncle died of that. Okay, so there's diabetes in the family, so I have to be checking. Okay. Every year I check. Okay. I check my meals, make sure you eat, exercise. So it's like you are ahead of the disease, okay, because you know. Okay. So even if it shows up, it might not be as bad as someone who's just nonchalant and not doing anything about it.
So we have a question here. It says, does fasting and losing weight in general help clear fats and cholesterol in blood vessels? So that's the question, if fasting and losing weight.
It's good to fast, but you should be monitored by a clinician or a doctor or a nurse or something, because what happens is when you fast, you are pushing your body. You are actually making your body break down the energy, because there's no food to glucose. So the body now turns to the fat. It breaks down the fat to ketones, gives you the energy, and there's a lot of ketones in there, in the blood, which can give you hyperacidity, high acid in the blood, which is not good for the body, leading you to hyperventilation, confusion, and all that. So when you are diabetic, it's not good to fast, because you push your body, and then it does more, and then it puts you at risk of something we call diabetic ketoacidosis. Okay. And then also, when you are not diabetic, when you fast, you shouldn't be too long, so that you would have a way to recover your body in the right way. Some people fast for long and they just go straight. They're going to eat banku. You don't do that. It takes a process because you have weaned yourself off food for a while. So you need to quickly get the body back to eating. So it takes time. And I know we're not talking about peptic ulcer, but fasting also puts you at risk of peptic ulcer, which is increased acid in the stomach. Okay, so fast with discretion. Fast with this.
So yes, about the fasting thing. So he's asking about the fasting inside the blood vessels. You see, you mentioned that, you know, sometimes the cholesterol tends to clog up the blood vessels. So does fasting make, you know, clear all those things out? And if it does, isn't there a risk of, should I use embolism too? Yes, an embolism, a fat embolism in the blood. Okay, so that's why you shouldn't overwhelm your body. Okay. Because the fasting would eventually start working on the fat, but the fat doesn't work on the fat. You see, the hypertension is cholesterol in the blood vessel. Okay. The fat is in the tissue. Okay. Is in the tissue. You have the skin, epidermis, dermis. Then we have so it's inside the tissue. The hypertension is the cholesterol in the blood vessel. So fasting is not going to reduce the cholesterol in the blood. It could do it minimally, but ideally change of diets. Okay. Not like say you will not eat, but like the right kind of food could clear this thing. But when you fast, you overwhelm the body with so much of the breakdown of the fats. And then that's when the ketoacidosis comes in the keto. You notice some people fast and lose sick. Yes. Like, or they are on a weight loss and they look sick. It's all because the body is overwhelmed with the toxins that have broken down for it to excrete. Yes. Then we have kidney issues. Okay, okay. So back to the diabetes. So we moved away from the cholesterol issues. Can you walk us through how it's diagnosed? I mean, we've done a little bit about the number ranges, but let's an extensive approach to how it's diagnosed, if you can. So like I said, we have the fasting blood sugar, we have the glycated, we have the random blood sugar, which are ways to be able to pick up with the glucometer. And then when we pick up the values and they are high, the first thing we do is diet management. Okay. And then we start you on the orals. Okay. That's the metformin, the biguanines. We have the sulfonylureas. These are a range of medications. Okay. We start you on them, and then we see how you do well on it. Then you start with the follow-ups. Okay. So every month you come and have your fasting blood sugar. Before you come to the hospital, your last meal before coming to the hospital the following day should be by 6. Before 6 you've eaten. Okay. So that early morning, 6 to 7, you can check your fasting blood sugar. When it's checked, if it's high, then we know that, okay, the meds aren't doing too good. We increase the dose, then you go on. So it's like that. So when you come, a time will come that your sugars are too low, and we are like, okay, now that you started having a good diet, eating well, your meds are given, I think it's too harsh for your body. Yeah. So we taper down the medications. But one thing you should note, being diabetic can put you at risk of hypoglycemia. Okay. That's low sugar, which is deadly more than hyper. Hyper is high sugar. Yeah. So most diabetics are counseled on taking cubes of sugar when they feel jittery, sweaty, like confused, and a bit feeling like they're sinking. Yeah. Then quickly taking malt or something. You should be aware of the symptoms. Unfortunately, the aged or the elderly, they don't show symptoms much. That's how come you say this old man slept and died, because he might have been hypoglycemic in his sleep, but he just slept it off. Okay. But the younger you are, you're able to project with symptoms. So the hypoglycemia is very important. You need to know that in as much as we are trying to bring the sugar down, we shouldn't overdo it. Okay. So about the uncontrolled diabetes, what are some of the very serious effects if you know you're diabetic but you're not doing anything about it? So it can affect your eyesight, you have blurred vision, you have visual loss, we have something called diabetic retinopathy. Retina is related to the eye. So when it's retinopathy, that's pathology of the retina of the eye. So that can be diabetic retina, leading to loss. There could be cataract,
you could have glaucoma. And then also there's something we call peripheral neuropathy.
Okay.
Some of them will say they feel burning sensation in their body, they feel burning sensation, they feel numbness. All these are symptoms of diabetes, which show that your nerves are gradually declining in their efficacy. Okay, then that's the peripheral diabetic neuropathy. Then we could have diabetic nephropathy, where there's the kidney damage. Okay, and then the low kidney function, and then eventually you would have to start doing dialysis. And then being diabetic could put you at risk of stroke, where your blood vessels, eventually with the glucose in the blood, it kind of cranks the blood vessel, makes it breakable, thin, and then eventually you end up having stroke. And then another thing too is that the blood vessels become like, I don't know how it's not fresh. So it's more like it's gradually getting infected. Yes, good, that's the word. Hey.
So someone is asking that why is low blood pressure more dangerous than a high blood pressure?
Low sugar or
low blood pressure?
Pressure. So we're going back to hypertension. All right. So low blood pressure, that's hypotension. Usually when there's hypertension, it means most of the time the patient is getting towards coma. Level of unconsciousness are receding and all that. So it's quite an emergency to be hypotensive. And it's also not good to be hypertensive. But to be hypertensive means that you need to be on dopamine injections and all that. Like you are actually on admission, you are in the ICU and it's going down. But there are some people that have hypertensive BPs. The BPs are low naturally. You have an elderly woman coming with 99/60 and she's fine walking. So you should know your body. Just be friendly with the hospital. I don't know. I know we doctors, some of us have some front that makes it look so formal and unapproachable. But as much as possible, let the hospital be friendly in your mind and just be coming for your checks. Because someone's hypertension could be normal for the body. But with you, you could die. So if I wake up and my BP is like 90/60, that's a wake-up call for me. But then if I wake up, my BP is like 130, 125, I know it's fine. But then if someone who is hypertensive, her BP is like 90/60, and then wakes up with a BP of 130, that's high. So you notice that she starts having symptoms. So you should know your body and then report as such.
So back to the diabetes. So there's this whole thing about amputation. Yes, when someone literally... A large number of people I've heard of who have diabetes, by the time you realize something about cutting their leg off or an arm or just a peripheral part of their body. So how is that related? What does that even mean?
Yeah, so what happens is, like I said, the glucose causes infection, like blood doesn't flow well to a certain part. Eventually it starts decaying because there's no life there. Then the decay causes necrosis. Necrosis is like deadening of the tissue. And then it causes infection, and then it can spread through to the whole body, leading to sepsis, which eventually can cause death. So usually, as the Bible says, when something is not right, you cut it off. You just cut off the leg, which could be psychologically traumatic. People have amputation, at the end of the day, they can't thrive to it and they die. Not even from the diabetes, but the trauma of losing their legs. So amputation is very is preempted in people with diabetes, which is uncontrolled.
So when it's amputated, is it likely to heal then?
It takes a lot of work for healing. That's why you most of the time they are in the hospital for some time. They come for dressing in a sterile, clean environment, because that can also predispose you to infection again. Because if you don't do it at the right, so you need to be a cooperative patient. Most of the time, our elderly people, when they have those issues, they become more stubborn. They don't want to go to the hospital. They don't want to talk to anyone. They don't want to do anything, and then that's eventually. So you notice people do very well till they're amputated, and then you hear that after a year or some months they are gone, not because of the amputation, but the whole trauma around it.
So we have a question quickly before we wrap up. Please, honey is sweet to taste as well as sugar does. Can honey cause high blood pressure, as one doctor advised me and my family to always use?
That's a good question. You should be very wary of the source of the honey. If you can bet a bottom dollar that the honey is from a good source, that is right from the village or right from this particular place, it's safe. Okay. But you know now they kind of adulterate it with cubes of sugar and a whole lot of things to make it look natural. That's where the problem is. So I had this patient who I told her to stop taking sugar. She started taking honey. Even at that time, she wasn't even diabetic. So she started, so usually I just tell them, oh, stop sugar, take honey, on a usual regular talk, not knowing that she's even diabetic, because she was hypertensive, so I preempted probably it will lead to diabetes. Yeah. Then she comes with high sugars, and now she's on honey. And I'm like, oh. So I had to ask her where she bought it. We had to trace it, only to find out that it wasn't the correct honey she was buying. Okay. So over the 6 months period, she was taking the honey. It was all toxins she was putting in her body, which was too much for the body. So at the end of the day, she was frustrated because she said she fears diabetes and it has happened to her. I said, don't worry. So we had to cut off the honey immediately, cut off the sugar. Ideally she could do sweetness, but I just told her she should just go like raw with nothing and just eat her cocoa, her oats with nothing. And eventually it came down fast. Like it came down fast, everything normalized, and then we now realized she was now pre-diabetic in the sense that the true picture of what was going to happen was eventually happening, not as bad as when she was on the honey. So to a large extent, you need to be very careful of the source of the honey.
Okay, so you said hypertension and diabetes work hand in hand. So would you say that the ways to prevent hypertension would be similar to preventing diabetes? Okay. Because of time, I would urge our viewers to just stream our video again to watch and learn how to prevent hypertension and diabetes. We have to wrap up really quickly. So what are your closing remarks for our diabetic or pre-diabetic or even just literally everybody about diabetes?
So diabetes is like when you tell a patient you're diabetic, they feel like it's a death sentence. They don't want to hear. Most of the time they are in denial. I plead with the public to really see it as a whole community engagement, not just the patient alone. Diabetes needs the family. You need to, because what you eat, your wife will cook it, your sister will cook it, your brother will cook it. They need to know what you are eating, and you need to be honest. If you have cravings, once in a while you want to eat this, say the truth. Oh, I feel for this, I want this, but it shouldn't be too much. So your diagnosis has to be exposed. Everyone knows, and we are all there to support you. It shouldn't be something, it's not an individual, alone approach. But one thing you should know is that you have to own diabetes, like accept that you have diabetes and then fight it on your own. Choice of foods, stress, medications. One thing about diabetes is that it likes to follow correct, systematic medications take up. You need to know that, okay, at 8, I'm taking my meds. At 8 p.m. I'm taking my meds. Diabetes medication, you don't just take the meds anyhow, because the body follows a circadian cycle. You understand?
Thank you so much, Dr. Victoria Party-Newman. It was such an amazing time with you, and we hope to see you hopefully in October for our breast cancer talks. And thank you also, our dear viewers. So as you heard from our doctor here, diabetes medications follow a rhythm. So one advice I would like to give is you can set alarms for your meds. If it's 8 a.m. and 8 p.m., whatever it is, just set an alarm and follow it, because your life is in your own hands. So thank you. Oh, goodness. We have one more question. Okay, it's not a question. So someone wants to call you. So we will handle that later. We will get back to you and we'll give you her number. Miss Faustina will say we will talk backstage. So yes, this is, once again, this is our guest. She is Dr. Victoria Party-Newman. She's the resident public health physician at the West African College of Physicians and Surgeons. She's also the women's advocate. She's been a women's health advocate for the past 10 years and counting. And she's the CEO of Lady Bits Health and Wellness Foundation. And this foundation offers free mobile screening for women with regards to breast and cervical cancer screenings in the rural areas. But I'm sure she will do something for us in Accra here too. And then also she is a general physician at the Trust Hospital. So if you are looking for her, you can find her at the West African College of Physicians and Surgeons, as well as the Trust Hospital. And of course, you can look for Lady Bits Health and Wellness Foundation and get in contact with her. I'm sure she would leave her contact with us so that if you also have questions for her, we can direct them to her and give you feedback. And it has been an amazing morning, a very educative and informing morning. Thank you so much again, Miss Dr. Victoria Partey Newman. Thank you, my cherished viewers, for watching. Thank you to our technical team. A big thank you to our sponsors. A big thank you to everybody that made this a success. We are saying goodbye and we hope to see you again on Tuesday. Have a blessed day.
Clog TV, Beyond the Policy.